Human immunodeficiency virus, or HIV, is the virus that causes AIDS, the acquired immunodeficiency syndrome, a condition in humans in which progressive failure of the immune system allows life-threatening opportunistic infections and cancers to thrive. HIV can have serious consequences for you, your health, the health of your partner, and your military career. While there are treatments for HIV, there is no vaccine and no cure.
HIV. I'll never get that.
Why would my family have to worry about HIV?
I hear if you get it, you just take some pills. No big deal, right?
Infection with HIV occurs by the transfer of blood, pre-seminal fluid, semen, vaginal fluid, or breast milk. The virus can enter the body through tiny cuts or sores in the skin or lining of the vagina, penis, rectum, or mouth. HIV cannot be spread through air or water, insect bites, saliva, tears, sweat, casual contact like shaking hands or sharing dishes, or closed mouth or social kissing. Since the mid-1980s, when HIV and AIDS became a heightened public concern, the nation's blood supply has been made safe. With greater awareness in drug treatment and needle exchange programs, HIV infection through needle sharing has been dramatically reduced. Today, HIV transmission in the U.S. is primarily through unprotected sexual intercourse. In other words, sex without condoms. And even with increased public awareness about HIV and the advancement in medical science over the past 30 years, the HIV infection rate has held steady over the past 15 years. About 1.2 million people in the United States are living with HIV. Of those people, about 1 in 8 do not know they are infected. Each year, another 50,000 people in the United States are infected with HIV. In the U.S. military, every 2 days, a fellow active duty service member is diagnosed with HIV. If we look at HIV infections by how people got the virus, we see that men who have sex with men are 40 times more likely to be diagnosed with HIV, compared to men who have sex with women only. In the U.S., HIV rates are increasing among only one group, young men who have sex with men. Although men who have sex with men constitute about only 2 out of 100 people in the U.S., they account for about 2 out of 3, or 63% of all new HIV infections. But here's the most important fact that you can learn. HIV is preventable. The most effective means of preventing HIV infection is preventing exposure. Saying no to sex or waiting until another time in your life to have sex eliminates HIV risk. Having sex in a long-term, mutually monogamous relationship with an unaffected partner eliminates your risk. For people who decide to have sex, condoms, used correctly and every time, greatly reduce risk. By using a condom during sexual intercourse, you not only reduce the risk of HIV infection, but other sexually transmitted infections, STIs as well. There are also medicines that can reduce your risks of getting HIV. One, taken before sex, pre-exposure prophylaxis, PrEP, and one taken soon after sex, non-occupational post-exposure prophylaxis, NPEP. And let's clear up a popular myth. Unprotected withdrawal, which is having penetrative sex without a condom, is not a safe HIV prevention strategy because HIV and other STIs can be spread even before ejaculation. Some kinds of sexual behavior are riskier than others. The highest risk sexual behavior is anal sex, and unprotected receptive anal sex is riskier than insertive anal sex. The second highest risk sexual behavior is unprotected vaginal sex. Having many sex partners or having other STIs can also increase the chances of getting HIV through sex. Getting HIV through oral sex is possible, but much less likely than from unprotected anal or vaginal sex. The Centers for Disease Control and Prevention, the CDC, recommends that gay and bisexual men who are not in a long-term mutually monogamous relationship should be tested for HIV at least once each year. This is also true for heterosexual men and women who have unprotected sex with many partners. Talk with your military medical provider about HIV testing. If you think you've been exposed to HIV, seek medical attention immediately at your nearest medical treatment facility. The decision you make about your personal sexual behavior can have serious lifelong consequences. They can change your life. Stay sober, stay in control, and remember, knowledge is power. The more you know about the risk and consequences of HIV exposure, the safer you'll be.
The hardest thing I ever had to do was tell my wife that I was HIV positive.
We were all hammered. I don't remember how it happened.
He said his HIV was undetectable. He didn't need a condom. I trusted him. Now I've got HIV.
The single most important skill you can learn to reduce the risk of HIV exposure is the consistent and correct use of a latex condom every time. It is an important skill we all should have. Get in the habit of carrying condoms where and when you might need them. Use a new condom for each act of vaginal, anal, or oral intercourse. Put the condom on before any penetration. After ejaculation, hold the condom firmly at the base and withdraw while erect to keep the condom from slipping off. When used correctly and every time, condoms greatly reduce the risk of getting or spreading HIV. Unprotected receptive anal sex is the sexual behavior that carries the highest risk for getting HIV. You have the right and the responsibility to protect your body and to protect your partner. Insisting on a condom does not mean I'm dirty or you're dirty or there's a barrier between us. In any adult relationship, it's important and normal to talk about safety. Simply explain that for you, condoms are a must. Today, more tools than ever are available to prevent HIV. In addition to limiting your number of sexual partners, never sharing needles, and using condoms correctly and every time, you may be able to take advantage of newer biomedical options, such as PrEP and NPEP. Again, PrEP stands for pre-exposure prophylaxis. The word prophylaxis means to prevent or control the spread of an infection or disease. The goal of PrEP is to prevent HIV infection from taking hold if you are exposed to the virus. This is done by taking one pill every day. The CDC recommends that PrEP be considered for people who are HIV negative and at a substantial risk for HIV. Who is eligible? Anyone who is in an ongoing relationship with an HIV positive partner. Any man who has sex with men outside the context of a long-term, mutually monogamous relationship. A heterosexual man or woman who does not regularly use condoms during sex with multiple partners of unknown HIV status may be people who are at high risk of HIV infection. If you think you may be at substantial risk for HIV, talk to your healthcare provider about PrEP. PrEP can provide a high level of protection against HIV and is even more effective when it is combined with condoms and other prevention tools. NPEP stands for non-occupational post-exposure prophylaxis. NPEP is used for anyone who may have been exposed to HIV very recently during a single event like a sexual assault, unprotected sex, or incorrect condom use. It involves taking medicine that keeps HIV from making copies of itself and spreading through your body. NPEP must begin within 72 hours of exposure, and it must be taken for 28 days. If you have a possible exposure to HIV, talk to your doctor right away about post-exposure prophylaxis. Your healthcare provider will consider whether NPEP is right for you based on the risk of your exposure. Keep in mind that NPEP should only be used in situations right after a potential HIV exposure. It is not a substitute for regular use of other proven HIV prevention methods, such as condoms. Because NPEP is not always effective, you should keep using condoms with sex partners while taking NPEP.
Instead of taking 5 seconds to put on a condom, I'm taking meds the rest of my life.
My dream was to fly. Now that may not happen.
HIV might not be a death sentence, but it is a life sentence.
HIV can have a serious effect on your military career as well as your health. It limits your ability to be deployed. DoD personnel who test positive for HIV are generally assigned to non-deployable stateside billets. However, on a case-by-case basis, there are exceptions being made. Promotions are partially based on duty history, and if your duty does not include deployment or you face restrictions on your job opportunities like air crew, air traffic controller, diver, or nuclear tech, and the special pay that goes with these jobs, your military career can be affected by an HIV-positive status. HIV will also affect your personal relationships for the rest of your life. Service members living with HIV must tell prospective partners about their infection and must always use a condom. And it's not just the physical aspect of HIV, it's the emotional aspect as well. The worry about your health, the stigma related to HIV, the fear of how you might be treated, feeling shunned. Although we shouldn't fear people living with HIV, unfortunately, some do. Getting HIV means you will be on medications for the rest of your life. Doctor's appointments, getting blood draws every 6 months. And think about the cost to maintain that health care throughout the rest of your life. HIV is a big deal. And even though advancements in medicine are making it possible for HIV-positive people to manage their disease and live relatively normal lives, ask yourself, do you really want to deal with HIV for the rest of your life? Especially when you can prevent it. Be proactive about your sexual health, your physical well-being, and your readiness to serve. Across military medicine, there are clinics, websites, and wellness information available to you. Take advantage of these resources. They are here to help give you a greater understanding and awareness about the risk, prevention, and treatment of HIV. Know your HIV status. Free confidential HIV testing is available at military medical treatment facilities. The Nurse Advice Line can also be a source for referral and scheduling a medical appointment. If you think you are at high risk of HIV, talk with your healthcare provider about PrEP and NPEP. For Department of Defense and non-DoD information, you can go online to the following resources. While great progress has been made in preventing and treating HIV, there are still 50,000 new HIV infections each year in the United States. With no cure or vaccine available, prevention is the key. Remember, you have options to reduce your risk of HIV infection. Abstinence. People can express affection in ways other than penetrative sex. Monogamy. Be in a mutually faithful relationship. Condoms. Practice safe sex. Condoms work. Decrease number of partners. Decrease high-risk partners and decrease high-risk sex acts. PrEP and NPEP. Talk to your doctor if you are at high risk for HIV infection or if you think you've been exposed to HIV. Protect yourself. It's your body, it's your life. Stay HIV free.